talk about the cardiovascular system. Because heart disease affects people of all ages and can cause serious complications, your ability to examine the cardiovascular system and teach self-care is a vital skill. To help sharpen your ability, this program will show you how to inspect, palpate, percuss, and auscultate the heart and assess the neck vessels. Throughout this examination, you'll see normal findings. Keep in mind that you may see these findings in your practice, or you may see normal variations or abnormal findings.
Before examining the heart and neck vessels, consider their anatomy. For example, visualize the major neck vessels, the carotid artery, internal jugular vein, and external jugular vein. The carotid artery lies in the groove between the trachea and sternomastoid muscle. The internal jugular vein lies deep and medial to the sternomastoid muscle. Although the vessel may not be visible, its diffuse pulsations may be seen in the sternal notch in a supine person. The external jugular vein is more superficial. It lies lateral to the sternomastoid muscle, above the clavicle. Beneath the precordium on the anterior chest, envision the heart and great vessels. The heart is like an upside-down triangle. Its top is the broad base, and its bottom is the apex, which points down and to the left. During contraction, the apex produces an apical impulse, which normally is palpable at the 5th interspace, 7 to 9 centimeters from the mid-sternal line. The heart's chambers include the right atrium, right ventricle, left atrium, and left ventricle. The atrioventricular, or AV valves, separate the atria and ventricles. On the right is the tricuspid valve. On the left is the mitral valve. 2 semilunar valves are set between the ventricles and the arteries. On the right is the pulmonic valve. On the left is the aortic valve. The right ventricle forms most of the anterior cardiac surface. The left ventricle lies behind it and forms the apex and part of the left border. The right atrium lies to the right and above the right ventricle, forming the right border. The left atrium is located posteriorly. The great vessels of the heart include the superior vena cava and inferior vena cava, which return unoxygenated venous blood to the right atrium. The pulmonary arteries, which leave the right ventricle and carry unoxygenated blood to the lungs. The pulmonary veins, which return freshly oxygenated blood to the left atrium. And the aorta, which carries it out to the body.
How are you today?
Fine, thanks.
I'm going to feel your neck and feel your carotid arteries.
To assess the carotid arteries, palpate them one at a time. Using your index and middle fingers, gently palpate the artery medial to the sternomastoid muscle in the lower half of the neck. Feel the contour and amplitude of the pulse, which should be the same on both sides. Normally, the contour is smooth, with a rapid upstroke and slower downstroke, and the amplitude is moderate.
Mr. Zamora, I'm going to use my stethoscope now and listen to your carotid artery.
Next, auscultate the carotid artery. With the person's neck in a neutral position, ask him to take a breath, exhale, and hold it. As he does, lightly apply the stethoscope bell over the carotid artery at the angle of the jaw, mid-cervical area, and base of the neck. You should hear no bruits, which are blowing, swishing sounds that suggest turbulent blood flow and atherosclerotic narrowing of the carotid artery. Bruits sound like this.